emergency care, every drop counts. A puppy in hypovolemic shock has minutes before organ failure becomes irreversible. Too little fluid and perfusion collapses. Too much, you flood the lungs. Precision, not the speed, decides the survival of our patient. I am Dr. Sumati Devaraju, Professor and Head, Department of Veterinary Clinical Medicine, Veterinary College and Research Institute, Namakkal. 2 decades of critical care practice has taught me the outcome of most emergencies is written in the fluid plan. Today we will explore why, when and how to give fluids to our critically ill patients. Fluid therapy is physiology in practice. To treat right, we must know where the water is, where it is lost and how to restore it. Never guess. Precision saves. 60% of the body weight is water, 40% is intracellular and 20% is extracellular. Of this 20%, 3/4 is in the interstitial spaces and 1/4 is plasma. When we say dehydration or shock, we are describing which compartment has lost water. Dehydration shrinks interstitial and intracellular space, whereas shock drains the vascular compartment. Your choice of fluid must match the space you are trying to refill. 3 conditions mandate fluids. 1 is shock, 2 is dehydration and 3 is ongoing losses. In shock, there is perfusion deficit. Tissues starve for oxygen, which is displayed as pale gums, weak pulses, delayed capillary refill, chilled extremities. While in dehydration, which is developing quietly, there is skin tenting and dry mucosa. We also see concentrated urine. Ongoing losses are from vomiting, diarrhea or polyuria. We should calculate and replace each category specifically, otherwise we chase the deficits which never end. Rote defines response. Oral rehydration works only when gut works. Subcutaneous fluids suit mild dehydration. It can be used in chronic conditions. Intravenous is used for rapid, life-saving infusion. Use the largest bore, shortest catheter possible. If veins collapse or patients are too small, intraosseous access can deliver fluids as efficiently as IV lines. Crystalloids are water-based solutions with electrolytes that move freely between compartments. Isotonic solutions like lactated ringers, 0.9% normal saline, plasmalite A replace extracellular losses and treat shock. Hypertonic fluids like 5% dextrose rehydrate cells but offer very little vascular support. Maintenance solutions with potassium sustain long-term therapy. Hypertonic saline 7 to 23% pulls water into the vessels rapidly for shock, but never use in severe dehydration. It worsens cellular deficits. Colloids contain large molecules that stay inside vessels, creating oncotic pressure that draws water from the tissues back into the circulation. Synthetic colloids like heater starch offer short-term support but carry renal risk, and it should be used judiciously. Natural colloids like whole blood, packed RBCs, plasma, albumin restore volume and oxygen carrying capacity in case of hemorrhage and hypoalbuminemia. For bleeding patients, blood is the only true replacement. Crystalloids, please avoid. Precision is mathematical. Total daily fluid requirement equals maintenance plus dehydration deficit plus ongoing losses. For dogs, 60 ml per kg per day, and for cats, 40 ml per kg per day will meet the maintenance. Dehydration deficit is body weight times percentage dehydration. Correct them gradually over 24 hours. Add loss from vomit or diarrhea to this volume. The result gives you infusion for a day. Verify before starting the infusion. Fluid therapy is dynamic. Assess response hourly. Like look for heart rate, pulse quality, capillary refill, mucous membranes, temperature and mentation. There are laboratory markers like your PCV, total protein, urine specific gravity, which can confirm correction. A rising body weight over 10% signals overload. Watch for tachypnea, nasal discharge, crackles, chemosis, and limb edema. When these are seen, slow the infusion and administer furosemide. The goal is hydration and not hemodilution. Severe dehydration and shock reduce gut blood flow, damaging the barrier that protects against endotoxins. A healthy microbiome produces short-chain fatty acids that repair this barrier, reduce inflammation, and stabilize immunity. Well-nourished patients recover faster with fewer complications and shorter hospital stays. Comprehensive care means fluids plus nutrition. Godrej Ninja is formulated for providing high-quality protein for tissue repair, balanced calcium phosphorus for metabolic stability, omega-3 fatty acids for anti-inflammatory support, and there are 3 P's: probiotics, prebiotics, and polyphenols. Together, they strengthen gut barrier integrity, reduce systemic inflammation, and accelerate recovery. Fluid therapy is where physiology and precision meet. Know your compartments, calculate accurately, monitor vigilantly, and support nutritionally. When you combine sound science with complete care, you don't just stabilize your patients, you restore their lives.